Word that teachers and school staff can start rolling up their sleeves and get the COVID shots as soon as today is welcome news for thousands of families.
Of course, the question is, does that mean schools can reopen soon? Joining us right now are State Superintendent Chris Reykdal and Secretary of Health Dr. Umair Shah. Good morning to both of you, and thanks for joining us.
Morning.
Dr. Shah, let me start with you with a two-part question. It is already a struggle right now for people to get a vaccine appointment today. So now with 160,000 public and private teachers and childcare workers who are now eligible, what's the plan to get them vaccinated as quickly as possible? And does this mean that it's going to be difficult for the seniors who haven't gotten their shots yet?
Well, first of all, this announcement yesterday is just underscores what in Washington we've been saying throughout, which is we did believe and do believe that our educators are absolutely a priority. And as you just said, we had seniors who we're vaccinating right now, and certainly as a part of our essential workforce right after seniors were teachers and a whole host of other individuals. And so this is welcome news. And what I would say is that we are obviously concerned about making sure that our seniors and those who are trying to get appointments, that they can still get appointments. But while we do that, we also recognize that the federal government, in its announcement yesterday, President Biden talked about the federal pharmacy program as being a place where states would be leaning on having teachers be able to get vaccines as well. So it does look like not only is this an announcement from the federal government, but they're also putting some operational aspects of how to go about executing on it, which has also been welcome news.
This one for you, Superintendent Reykdal. It has been such a tough year for families in remote learning, including your own family. You're a remote dad. Just 36% of students are actually back in the classroom in our state right now. Now that the governor is allowing teachers to be eligible, is there any reason a school should not reopen for in-person learning?
Well, this will really speed things up, I think, in parts of the state that have struggled so far. Again, we've got more than 200 districts back, lots of kindergarten through 5th grade, more middle and high school. We're up to nearly 40% of students. This will help a lot in that. We will still have to maintain our health and safety framework, though. Students won't get this vaccine for a very long time. They still go home to vulnerable parents and grandparents at times. So this is going to really expand our ability more quickly to open schools. But all of that health and safety framework that's currently in place, including physical distancing right now, that will all stay in place for the foreseeable future. So, this will help a ton.
So you think all schools should basically be reopening because of this new order?
Well, we believe schools were safe to reopen prior to that. We've demonstrated that through districts around the state, through research around other states and other countries. We have incredibly low rates of transmission. And as of last week, no hospitalizations as a result of school transmissions. So you can open safely without a vaccine. This just puts a tremendous foundation under all of those safety protocols and makes it that much more viable for anyone concerned about reopening schools.
But Dr. Shah, one of the issues that schools are facing is the health and safety protocols. Of course, that includes maintaining 6 feet of social distancing. And some districts say they really can't reopen under those guidelines, even if they get their teachers vaccinated, because they just don't have enough space. So they're asking for modifications. Will the Department of Health be working with districts on this?
Well, I think the Superintendent Reykdal just said something very, very important, which was vaccinations were not a prerequisite for getting schools to be reopened in person. But the prerequisite the two prerequisites that were in place was, one, the ability for schools to have the protocols in place, the preventive measures in place, and also to be in a situation where you have community transmission that's down, which means that it's all about us as adults to do everything we can to keep transmission rates down, wearing our masks and doing those things so we can obviously get our kids back in person. But as far as it goes with the 6 feet of physical distancing, we are following that CDC guidance. So we do believe that is the optimal way for us to be protecting not just the kids, but the teachers and others in the schools. Now, that says, as science evolves, if there's more information, we will certainly continue to look at it.
Yeah, Dr. Shah, though, this order is going to make some other essential workers who are not, quote, eligible for the vaccine yet to sort of be moved down the list potentially. They might feel that way. What about them? What's the criteria to getting into the next phase here to get as many people as possible on that list?
Well, look, the biggest thing right now is supply, and I do think that we need to continue to emphasize the importance of getting as much vaccine into the state of Washington, and then working with our partners to get those vaccines into the arms of Washingtonians. The quicker, the faster, and the more supply that we get, the faster we can move down our prioritization list. And so right now we're focused on seniors. We want to make sure that our concerns about seniors, because of they're at risk for both for serious infection or even death, we want to make sure we're emphasizing seniors. But look, your time is coming, especially if you're in those essential worker categories. And so we're trying to do everything we can to get as much vaccine to Washington and then into the arms of Washingtonians.
Well, certainly encouraging to hear that 50% of people 65 and older in our state have gotten at least the first dose. That's definitely a start. Dr. Umair Shah with the Department of Health and Superintendent Reykdal, thanks so much for joining us this morning.
Thanks, gentlemen.
Thank you.
Thanks for having me.